A hearty good afternoon and welcome to a session on lifestyle and its effects on fertility. We're glad to have Dr. Ramyasree Reddy among us today to help us explore this topic. It's very important for us to understand how lifestyle and the effects of lifestyle has an effect on fertility of a person, right from the exercise to food to even the living conditions. And all these affect the health of a person as well as the fertility. So the doctor is going to help us understand more about this relationship of lifestyle and its relationship to fertility. And if you have any questions towards the end of the session, you could ask the doctor, and the doctor will be here for us. Doctor, you have the stage.
Thank you. Good afternoon, everyone. This is Dr. Ramyasree Reddy. I am a consultant fertility specialist at Apollo Fertility, Nagar, Chennai. Welcome to this Facebook Live session. Today we'll be talking about the lifestyle effects on fertility. As we all know, there is an increasing burden in the amount of infertility related issues going on. That cannot be attributed just to a single thing. Along with all the other lifestyle modifications that are happening, we are seeing the rise in the fertility issues. So I'll be taking you through the lifestyle factors that affect us. Broadly, we can talk about a few aspects like smoking, alcohol, obesity, environmental pollution, stress, and occupational factors. First, talking about smoking. Uh, with the smoking, we are seeing there is certain amount of rise in both male and female smokers, and more so, we see this happening at a higher level in the reproductive age group. That is the age group which is looking at fertility potentially. So, what happens when there is smoking is in the female smokers, there is an effect on the development of the follicles, the transport of the embryo, the way the uterine lining behaves, as in the way it receives the embryo, and the blood flow in the uterus. All these are getting affected. In male smokers, what happens is there is amount of oxidative stress which is getting increased. This leads to harm in the DNA production process of the sperm. Also, it affects the count and the capacity of the sperm to fertilize the ova. So, this leads to reduced chances at the pregnancy potential. Not just active smoking, passive smoking also has a significant role. And when we look at the spontaneous miscarriage rates, that's the abortion rates, they're higher in non smokers as much as 5% when you compare to the same age group non smokers. So the American Society for Reproductive Medicine has also confirmed the same and has opined that there is ovarian follicle depletion happening in female smokers, and this not just affects causally, it also has a dose dependent effect. As in, the more number of cigarettes you smoke, the longer you're exposed to the smoke and things like that, there is that much reduction in the follicular numbers, and there is fall in the AMH levels also. So much so that there is also early menopause happening in these women. And in male smokers, like we discussed before, there is reduction in the sperm density, motility, antioxidant levels, and the DNA fragmentation in the sperm is also happening in a higher level. And in people who are pregnant and taking the smoking, there is increased risk of miscarriage, and the risk of ectopic pregnancy is higher. Ectopic pregnancy, as in the pregnancy happening elsewhere apart from the uterus. It could be in the tubes, it could be in the ovary, it could be in other abdominal organs, which is not healthy at all and can be of higher risk. So, like we discussed, tobacco smoke has an effect on the spermatogenesis, affects the density, sperm function, hormones, and also has the effect of DNA fragmentation, which is higher. Now, talking about alcohol, this is also on the rise. And there was a dose response meta analysis which was done in 2017. It talks about around 1 lakh women, wherein there was a 13% decline in fecundability in comparison to the non drinkers. Now, you would ask me, what is fecundability? Fecundability is the potential of a woman to conceive within a menstrual cycle. So, in 1 month of a period, how much chance is it that a woman could conceive? That is an age dependent factor. And apart from age, let us see what else affects it. The alcohol also affects it. Let us say there's a woman who takes 1 drink a day, that would come under the light alcohol usage. And somebody who's a moderate or heavy drinker, somebody more than around 5 drinks comes under heavy drinking. So in light drinkers, as much as 11% decline in the fecundability has been noted. And with heavy drinking, it's going as high as 23%. There are also studies talking about alcohol effects in men, where they're seeing in men and women both, there is reduced oocyte yield, less fertilization rate, and less live birth rates. So, whenever somebody is going for IVF process, it is prudent to suggest to abstain from alcohol. And in pregnancy, when somebody is taking alcohol, has a higher miscarriage rate, and also there is chance of fetal developmental defects, which we call as fetal alcohol spectrum disorders. This could mean there is a dysmorphic phase, there could be growth deficit in the child, or any CNS abnormality, depending upon how severe the alcohol intake has been. So, in pregnancy, absolutely recommended to abstain from any alcohol intake. Now, talking about obesity and overweight, we are seeing this very much on the rise everywhere, all around the world, and also in India. So, what do we mean by obesity? There is something called the body mass index, wherein it's a weight to height ratio. So, a general normal body mass index ranges from 18.5 to 25. So, with this is the normal range. And 25 to 30 comes under overweight, and 30 and above comes under obesity. Now, let us see how obesity is affecting. That does not mean that overweight is not affecting. Both overweight and obesity have a role. It is required for us to keep our BMI very much under control. What happens in obesity is there is increased insulin resistance in the body. With this, the body senses that the insulin is not sufficient, and there is more and more feedback production of insulin. And along with this, what happens is with the body fat, which is getting deposited in the peripheral areas, there is more conversion of androgens into estrogens. So when there is higher estrogen level, this brings a feedback to the central system, that is the CNS or the HPO axis, which is the pituitary, and it says produce more hormones to bring out the same capacity. So with all this happening, what is going to happen? The menstrual cycle is becoming irregular. So as the woman puts on more and more weight, we see that the cycles are irregular. And then there is follicular development, the various stages of development, those are getting affected. Follicular maturation is getting affected. And then later, in case of fertilization, there are fertilization defects. And at the time of formation of embryo, there is abnormal meiosis happening. And then, if there's a woman with obesity and pregnant, there are higher chances of miscarriage, poor pregnancy outcomes, and impaired well being. So, like we discussed, obesity not just affects fertility, has an effect on the pregnancy. Then, the other systemic effects are like type 2 diabetes, heart disease, stroke, cancer, etc. Now, let's talk about what happens when when a woman who is looking at a potential fertility treatment is overweight or obese. What happens, there are people who are coming in day in and day out, slightly on the heavier side, BMIs of around 31, 32, and then they're seeking potentially IVF, probably for whatever factors be it. Then what we are going to generally counsel them is saying that, see, we see that you're slightly on the heavier side. When the weight is heavy, what happens is not just there is an intrinsic problem with the development of follicles, you're necessarily going to need more number of injection doses to bring in the same follicle number, as in to bring out the same number of oocytes at the pickup. We are going to give you more days of injections, more doses each day. That not just has an effect on your duration of treatment, on the cost of the cycle. With all this done, we are not able to guarantee that your oocyte yield is as good as a regular BMI woman. And it could also lead, in some cases, there is a poor response, cycle could get cancelled also. And the live birth rate is also significantly low. One more thing to keep in mind with obesity is the association with PCOS. Like we all know, PCOS is also very much on the rise. And like PCOS and obesity, the thing are they are both having similar problems. The crux is the same. There is insulin resistance, there is hyperinsulinemia, and PCOS women are obese. And this problem becomes a cycle wherein there is anovulation, infertility issues, people are obese. It just keeps going on and on. Now let's see how obesity affects men. In men, also the same way, with the peripheral fat getting accumulated everywhere, like we previously discussed, the male hormone is getting converted into estrogen in the body. It happens both in the female and in male. So, in the male, when the male hormone level is reduced and gets converted into female, what happens is there is reduced testosterone. When testosterone is less, that has an effect on your semen analysis. The sperm bringing potential is brought down. Then there will be a higher temperature in the scrotum because of this adipose tissue deposition. So, with the higher temperature, again, the development of the semen and sperm cells is getting affected. And the more the fat deposits happen everywhere, there is a chronic inflammatory state, which we call. So that also brings down the quality. And along with that, we also see the sexual performance getting affected, wherein these men have erectile dysfunction, etc. So, how do we combat this? We need to plan as your fertility care providers. We advise you how do we go about making this weight not a significant issue. So, it's not wise to say, let's say a woman is coming down at the age of 40 with a BMI of 32. I can't just sit and tell her, your BMI is 32. I want you to go take 3 months, 4 months off, go reduce your weight and come back, because that is no way it works. It just adds up to the phenomenon of stress, which is already inherently there in the fertility treatment people. So, what do we say? We put in small targets. We would be like, let us start with 2 kgs loss, 3 kgs loss. We will discuss what kind of diet which will help you tackle the weight issues better. So, we would be like, okay, let us say we want you to keep in mind, let us say this month, 3 to 5 kgs of weight to be reduced. So, what would we do? It's both diet and exercise related. Both of these have to go hand in hand for them to work out better. So what do we do? Let us say how. Then their important question is, which food items do we take to make this weight loss happen? Like we discussed, the easiest and the best phenomenon would be, first reduce the size of the plate which you're eating. Take a smaller plate and ensure in the smaller plate you have all the items which are there in the rainbow colors. That is, eat the rainbow, I would say. That is, eat green leafy vegetables, fruits of various colors, salads, vegetables, and high protein food. High protein food would mean, if you're a non-vegetarian, you can eat eggs, you can eat fish meat, which is very good, or you can, if you're a vegetarian, eat lots of dal, eat paneer, things like this. So generally, reducing the junk food, fried food, the easily available street foods, if you reduce these and combine that with some aerobic exercise. This aerobic exercise should be at least for a period of 150 minutes in a week. That would mean at least half an hour, at least for 5 days. You need to genuinely work. Let us say, be it walking, dancing, yoga, whichever you're comfortable with. Apart from just casually walking, putting your earphones on, talking to somebody and walking, not that kind. Brisk walking. Have a good pace, walk around, work towards it, and losing weight should not be a problem. Avoid the junk food. Treatment and weight loss should happen hand in hand. Then, so obesity and overweight people seeking fertility, they are usually advised and educated on the benefits of this, and we also let them know that this happens, and the success also gets much improved because of that. And the key for it is compliance. Then coming to talk about the environmental factors, with the increasing pollution and a lot of people having occupational exposure to insecticides, bisphenol A, these all are called the endocrine disrupting chemicals, and these also have a bearing on the fertility issues. Now, talking about stress. Stress has now, I can say, become an intrinsic part of our life. Be it an LKG child, be it a college going teenage person, be it a person who is working, be it a person who is a homemaker. I would not say stress is new to anybody. All of us very much deal with some part of stress in a routine basis. But when that starts to disrupt your health, that is the kind of stress that is to be stayed away from. Disrupting your stress would mean disrupting your sleep pattern, something that is bothering you on a day in, day out basis. Those kind of things have to be calmed down, because stress and fertility are very much interlinked. When there is increased stress, that has a bearing on your fertility potential. And with the rising infertility issues, people again tend to get stressed up. So, good counseling and lifestyle adjustments are very much required for the same. Then talking about the occupational factors, there are certain people who are involved in shift kind of work, who work in the night sometimes, who work in the days sometimes, with lot of changes in their work pattern. This kind of thing has a bearing on your reproductive axis also, because it's all related to the hormones, and there is a diurnal variation in the hormonal axis and where the production happens. So with disturbed sleep and disturbed work patterns, these circadian rhythms are also affected. That leads to effect of the fertility potential also. So we've finished discussing about the various issues. I'm available now if you have any questions. I hope you could all understand the effect of lifestyle and fertility issues. So, if there are any further queries, you can always reach out to us. Thank you.